Hi everyone, I have one gist I want to give you guys. So, there was this lady that was struggling with insomnia. What's insomnia? Difficulty sleeping. She had difficulty sleeping, and we tried different things with her to help her to sleep. It was not working. Then her appetite started going down. We did a full blood count, and we also noticed that her particular parameters that tell us about vitamin, was also getting low. So we put her on different foods. It wasn't working. After looking at different researches and different papers, we thought about H. pylori. So we did a test on H. pylori and it was positive. So I asked her, have you been having chest pain? She said, no. Bloating? Yeah, she's been having bloating, but no chest pain. I said, okay. This is showing that H. pylori is positive. Now you ask me, what test did we do? Stool, not blood. A lot of people are doing blood tests for H. pylori, and one is positive, they start treating. We have a webinar to tell the difference between the blood test and the stool test and which one you should do. We started her on a treatment, went for 2 weeks, and then an extra week of another medication. I'll tell you more on medications during the webinar. And to our greatest surprise, after 2 weeks of completing the medications, her sleep started improving. We did a full blood count a month later, and it was up. Everything was up. We didn't change anything on the diet. She was still keeping the diet, right? She was still maintaining the therapies I told her to do to encourage sleep. But all of that started increasing when H. pylori was treated. So does that mean H. pylori could have a connection to all of that? More about that in our webinar. Okay, so why do we want to do this? Because a lot of people are getting misdiagnosed with H. pylori, number one. And number two, they're treating it wrongly. We're preparing a webinar to at least share with you more information about what H. pylori really is. What does it do in the body? How does someone actually get infected with H. pylori? I know there was a video that said if you kiss someone who has it, you can have that. More on that in the webinar, whether it's true, whether it's false. But a lot of people get infected from childhood. So it's always been there. It literally grew up with you. But then lifestyle and so many things can affect it and it becomes a problem. All right. So this is my invitation to you. We're going to share information about the location, how to get connected. We're going to share about the date and the time when we'll be having that webinar. You need more information. You need to know how to treat it. And you need to tell the difference between chest pain that's connected to the digestive tract and chest pain that is not. Because a lot of people are getting misdiagnosed. They have heart problems, but it's not caught early because they're treating ulcers. So I look forward to seeing you. Do have a good rest of your day. Thank you.